Hi everyone, and welcome to today's video. We're diving into a fascinating yet often misunderstood medical condition called Cushing Syndrome. It's not something you hear about every day, but it's really important to know about. So what exactly is Cushing Syndrome? How does it affect the body, and what can we do about it? Stick around because we'll break it all down in simple terms and sprinkle in some interesting facts along the way. Let's start with the basics. Cushing syndrome, also called hypercortisolism, happens when your body has too much of a hormone called cortisol. Now, cortisol is actually super important. It's sometimes called the stress hormone because it helps your body respond to stress. But that's not all. It also controls things like blood sugar, blood pressure, and inflammation. The problem? When cortisol levels stay high for too long, it can throw your body out of balance, leading to some pretty serious health problems. This is what we call Cushing syndrome. So, what causes these high cortisol levels? There are two main reasons. 1. External causes. The most common cause is taking medications called glucocorticoids, things like prednisone or dexamethasone. These are often used to treat conditions like asthma, arthritis, or even organ transplants. 2. Internal causes. Sometimes it's your own body that's the culprit. A tumor in the pituitary gland, a tiny gland in your brain, can send signals to your adrenal glands to produce too much cortisol. This is called Cushing's disease, and it's the most common internal cause. Tumors in the adrenal glands themselves can also make too much cortisol.
Breaking news.
Now let's talk about the symptoms. Imagine this. Your body is producing too much cortisol, and it starts to show in very specific ways. Here's what you might notice. Moon face. Your face may become round and puffy. Buffalo hump fat can build up between your shoulders, creating a hump-like appearance. Purple stretch marks. These appear on your abdomen, thighs, or arms. Weight gain. Most of the weight is in the upper body, like your belly. Thin skin. You might notice easy bruising or slow healing of cuts, but that's not all. You could also feel constantly tired, weak muscles, especially in your arms and legs. Mood changes like depression or anxiety. Here are some lesser-known facts that make Cushing syndrome even more interesting. First, misdiagnosis is common. The symptoms, like weight gain and tiredness, can be confused with other conditions like obesity or stress. Many people go years without knowing they have Cushing syndrome. Second, it affects men and women differently. Women might experience excessive facial hair or irregular periods. Men, on the other hand, may face low libido or even erectile dysfunction. And finally, it can happen in children. In kids, Cushing syndrome often causes obesity and stunted growth, which means they may not grow as tall as they should. If Cushing syndrome is left untreated, it can lead to some serious complications. Heart problems like high blood pressure and heart disease are big risks. Your bones can become weak, a condition called osteoporosis, and high cortisol messes with your blood sugar, leading to diabetes. Too much cortisol weakens your immune system, so you might get sick more often. Now, you might be wondering, how do doctors figure out if someone has Cushing syndrome? It's actually a multi-step process. First, your doctor will ask about your symptoms and whether you've been taking any glucocorticoid medications. Next, there's a test where you collect your urine over 24 hours to check for high cortisol levels. They might also test your saliva late at night because cortisol levels should naturally drop at bedtime. If your cortisol levels are high, doctors will use scans like an MRI or CT scan to look for tumors in your pituitary or adrenal glands. The good news is that Cushing syndrome can be treated. Here's how. There are medications to lower cortisol levels like ketoconazole or pasireotide. If a tumor is causing the problem, surgery might be needed to remove it. The good news, advances in minimally invasive surgery have made recovery much easier. Eating a healthy diet and staying active can help manage symptoms and improve overall health. Cushing syndrome is rare, which means many people don't recognize the symptoms. That's why awareness is so important. Early diagnosis and treatment can make a huge difference in someone's quality of life. If you or someone you know has unexplained weight gain, fatigue, or any of the symptoms we've discussed, don't ignore them. Speak to a doctor and get checked out. It could save your life. And there you have it, a complete guide to Cushing syndrome explained in simple terms. We've covered what it is, what causes it, the symptoms, complications, and how it's treated. If you found this video helpful, don't forget to like, comment, and subscribe to our channel. Share this video with your friends and family so more people can learn about this rare condition. Thank you for watching, and I'll see you in the next video.